any lump, anything new, any change. It's very important, and we would usually start diagnostics with an ultrasound scan, and then maybe mammogram, maybe MRI, some other diagnostics will follow. But for younger ladies in their 20s, early 30s, we would start with a breast ultrasound scan.
Apart from that, the self-examining aspect of it, and I remember on numerous occasions I've been told that this is in existence, and you're told this is how you go about it. Could you paint a picture of how this can be done, or maybe we leave that one for Jen?
I think easiest is to always show it on a person. So that's why it's always best to do it one-on-one. Now, examining, most important is knowing your breasts.
Right.
Breasts, especially young ladies, the breasts will change. The breasts will change according to the
ages, which actually gets people confused. Sometimes it's a whole different feel, it's a whole different shape. With age, with what you say, sometimes you're pregnant, it's a whole different affair. So you might get confused in between.
That's true, and that's why it's very important. And usually when I see my patients, I tell them, please examine your breasts. I give them homework. Examine your breasts once a week for 6 weeks.
All right.
Because this is the way to understand what's going on, how the breast tissue is changing. But the best time to examine breast is usually about 4th, 5th day after the period. And we shouldn't examine more often than once a month, maybe once every 2-3 months.
Right.
Any change, anything new, any change in the shape or change in skin or change in nipple, it could be leaking nipple or maybe inverted nipple, it is important to investigate. And then mammogram or ultrasound scan are the tools, or both together. We have MRI, which help us investigating.
All right, let's overlook the hormonal changes and imbalances that would occur, in a woman or a woman. What are the symptoms, would get you being worried? I know you've mentioned some of them, but to what level then does it go where you now say that it's important that you seek medical advice?
Breast cancer is very silent.
Okay.
Comes without pain. Usually we expect something sudden. We expect pain. We think that it will start aching and this is the time to see the doctor. No. I know of cases, I know some patients who had big lumps or other changes, no pain, and they didn't take it seriously.
All right.
Breast cancer can come with skin change, any skin change. And I've learned a lot from one of my patients many years ago.
All right.
She came back from holidays with a little spot. And she said, oh, I think something has bitten me.
Okay.
I thought, yes, she came from holidays, so it's very possible. But at that very day, I was in the clinic with a very experienced breast care nurse. And the breast care nurse told me, you know what, please biopsy it because it could be something. By the time the patient came back to discuss the results, 2 weeks later, the breast was hot, red, swollen. This was one of very rare inflammatory cancers.
Okay.
So any changes to the skin, very common changes, so-called orange skin. It could be any changes to the nipple, leaking nipple, especially bloody or watery discharge. And lumps, bumps, of course, it's very important to investigate. Now, I mentioned earlier mammograms, because mammogram is the recommended screening tool, which can find cancer very often about 3 to 4 years before it becomes lump. That's why the screening is so important, because this is the time we can cure cancer, this is the time we can cure it very often with a bit of surgery, and very often we can avoid things like chemotherapy or all the other treatments.
Okay, well, in that case then, how do you lower your risks of getting breast cancer, if at all there?
The biggest risk of getting breast cancer is being a lady.
Okay.
Being a female.
Automatic, that's an automatic.
And we did talk about it. Breast cancer happens in Western world to 1 in 8 ladies. It may happen to 1 in 8 ladies. The most recent data here for Kenya say that it may happen to 1 in 10. Okay, so when we go outside and just look around, 1, 2, 3, 5, 10, potentially there are a few of my patients. How do we lower the risks? We know that 10%, we can prove that about 10% of breast cancers run in the family, and then the risk is even higher. The risk of developing breast cancer with family history, it's up to 90%. So the problem is, it will happen, the question is when. Now, yes, like with any other cancers, we can help, because the other 90% happen and we don't know why. But, for example, many breast cancers feed off estrogen, the female hormone. So being active, reducing the fatty deposits, fatty tissue may help. People talk about less alcohol, cigarettes, of course. Cigarettes smoking causes other cancers and may be involved in, maybe causing breast cancer as well.
Okay.
Some vaccinations. Now, we know, for example, that, and we started already the vaccination for cervical cancer. There was a study done in the UK, and we found, the team who did the study, they found human papillomaviruses in breast cancer tissue.
Okay.
So it may help as well. We don't know yet because it's very early stages, but it may help. So yes, healthy lifestyle, balanced diet, being active definitely lowers the risk of breast cancer.
All right. Okay. Well, we have Jane Francis on standby on the other side of the studio, so she will be joining us. I think it's only fair that we take a short break, and then will allow us to incorporate her in the discussion, or have her joining us in the discussion. That is very crucial for every other woman, for every other man out there. We still have Dr. Marek with me this morning as we expound some more on breast cancer and, you know, the awareness that needs to be, pushed out there so people stay woke. And importantly, we have Jane Francis joining us. She is a cancer survivor. We'll be taking us through her story briefly because of time. And I think I'd want to ask her this question. When we started, Jane, Dr. Ari says that, you know what, we're still on the inception stages of trying to push for this.
Yes.
But if my memory serves me right, we've had this conversation like about years back, 2-3 years back, or even 4 years back. The very same conversation. Why is it that we still look at it as though it's a new conversation that needs to be pushed out there? Are we not pushing the agenda so well?
No, and in fact we only do it in October.
Okay.
When is the last time we heard about it? Maybe last year, October, the other year. So for me that's not enough. We need to create awareness 24/7.
Yeah.
Because every day a woman is being diagnosed, and every other day I don't know how many people are dying. Right now as we speak, 2 days ago I lost one of my fellow cancer survivors. Last week I lost another one.
Yeah.
So just as they are dying, so many others are also being diagnosed. So it should actually be done every day. So whichever group in the government is supposed to do this advocacy, whether it's NSCI or whichever one in the Ministry of Health, should really do it more. And not just for breast cancer, for all other cancers. Even last month we had Childhood Cancer Month, but we had people, even I was talking about it, and people were like, you mean children also get cancer?
Right.
So cancer is there in our families, in our lives. It's just something that we have to talk about every day, and not just talk about, create awareness, prepare materials, IEC, make sure they're in every hospital, in every institution, in actually every office. So that if I walk in, not just the newspaper, I can also get something about cancer awareness.
Yeah.
A lot has been said about diabetes, polio and everything, and much of this has been controlled. But so far, cancer hasn't. And we are not even bothering to think of declaring it as a national disaster.
Yeah.
If, for example, our CS was always giving daily briefs on COVID, and people did very well, eating all these things, turmeric, ginger, lemon, and everything. These same things, if taken every day, not just COVID days, would ensure that not only breast cancer, but most of other non-communicable diseases are well controlled. Yeah.
All right. I am so lucky to be part of your contest, actually, because constantly she will send information out there about cancer, like year in, year out, and it ends there. That is the only place I can tell you, if I have anything to do with cancer, I'll run to. What's up? Really, are we doing enough to create this awareness that we're talking about? I know, Doctor, you said that there's so much that needs to be done, but that will overlook, and we hope that indeed people are going to take up this. But I'll look at what is right here on the table. I'll not allow her to tell us why she has carried all this, but I think you as a doctor would probably look at every other commodity that is on the table today and tell us what is the importance of this to a breast cancer patient.
Very important is the balanced diet.
Next.
Whenever there is imbalance in our body, cancer or virus or whatever else will be able to flourish and cause problem. Lots of these things, or let's say whatever we see, and we will learn about it a bit more in a minute, but very important is just to make sure that our immune system gets whatever supply it needs to be strong, to keep us healthy. And yes, I agree that there is an old saying, we are what we eat. So when we improve our diet, once we improve the quality of our food and the intake of, very often those natural protectors,
Right.
it does help. It does help with cancer as well.
Even, of course, when we're talking about, you mentioned something to do, it could be genetical and all that. In such occurrences, when you eat healthy, when you have a healthy lifestyle, are there chances that this would save you from,
It may reduce the risk.
Okay.
We don't know how much, but it's always good to do everything just to reduce the risk of cancer happening.
All right.
That's why being active, that's why having all that healthy food. And
Okay.
Yes.
Comes in. All right. So we speak of you being a cancer survivor, 6 years now.
Yeah.
Which is amazing.
Yeah.
But then again, you're a little bit too cautious on what you eat and all that, and what you take, the exercises and everything.
Yeah.
One then would argue, if you're a survivor, then it means it's over and done. You healed and that's it. I think it's important that we explain to the people just what it is, when we're talking about you being a cancer survivor.
Yes, I remember when I got cancer, the insurance that I had could only pay for me, I think 200,000 out of the 3 million that was required by my hospital here, and even going to India. And I tried to change to another insurance, and each one told me, no, we can't take you at that time. Today they tell you they'll take you, and then you wait a year and so forth. But why? I asked one girl, why is it always difficult to get that? Because one of the ladies told me, because you never heal from cancer.
Okay.
You don't. And I was very annoyed. Okay, I'm alive 6 years down the line, but it's also a challenge to heal.
Right.
I think cancer is like diabetes. Once you have it, it's something
so you have
to
to
live with it
Okay.
and manage it.
All right.
Yeah. So what happens after we do all the chemo radios? From what I understand from the doctor, he told me that the cancer goes into remission.
Right.
So even as you continue doing the biannual test, as doctor was saying, mammogram, I still have to do them, even though I have the cancer, because I removed one breast, I still have the other one.
Right.
So I have to monitor that one, do mammogram, sometimes ultrasound, sometimes X-ray, chest X-ray, and also other tests, even PET scan, if it's possible, because the cancer cells can also move from one breast to the other, or it's the same part, even maybe could be the chest wall, and you get recurrence, or they can move to another organ on the body, like the lungs. Quite often for us, breast goes to the lungs, spine, or brain, I don't know, anywhere. Actually, here, only the nails and the hair can't get cancer.
Okay.
So to ensure that that is monitored, of course, there is a healthy lifestyle, which I have to ensure that I am up to date with. I do exercises when I'm able, and much more have also a positive attitude.
Okay.
The other thing that kills people is that the moment you are told you have cancer, now that's a death sentence for many, which shouldn't be, because cancer should be also treated like any other disease.
Right.
And work at getting treatment very quickly, and so forth, and then thereafter manage it and have a positive attitude, pray with your family, with the church. I believe in spiritual help. Having a positive mind helps you accept first that I have this condition. Yes, it is expensive. Yes, it is stigmatizing and so forth. There's so many things. But having a positive attitude and then working at the treatment and whatever else the doctor tells you is very important.
Okay.
Some people have gone to like all this and no treatment, or even other traditional doctors. I have nothing against herbalists and all this, but I believe it's good to do the conventional treatment. In my case, it helped me.
Right.
In several cases of people that I knew that went there first and tried to come back to the doctors, it didn't work out very well.
Oh.
Yes. So I would suggest first do the conventional treatment, because it is scientifically based, a lot of research, and that medicine, whatever challenges it brings, because people complain of nausea. Of course, even me, I had all these things. But I remember my mother was then alive. Later, she died of liver and pancreas. So the genetic part comes in.
Okay.
Yeah. So despite those challenges that you go through, if you are well taken care of by the doctors, given nausea medicine and all that, it should not be as difficult as it is, unless it is discovered in a later stage, which is stage 4.
Okay.
So it's difficult to manage.
All right.
So let people go for early screening, detection, and so forth. Yeah.
Okay, Dr. Before we come to know what it is that we're talking about that is on the table briefly, we'll be lifting them up and saying, what is this, what is this, what is this? first, I want to pick what she said. Is it true that it's only the nails and the hair that that cannot have cancer cells, or I cannot get cancer? And also, must you cut the breast that has cancer cells?
Cancer is abnormal tissue which starts spreading.
Okay.
Every one of us every day has a few mutated cells. It happens to everybody, every animal on earth. Our bodies have special system which tells those cells, okay, that's enough, you are abnormal, you should die. Indeed, nails and hair are dead tissue, so there shouldn't be any cancer.
Okay, all right.
Now, for some reason which we don't fully understand, but it's everything we mentioned already, it's the food, it's the being active, it's everything else. For some reasons, our immune system or our it's actually mitochondria, they don't understand, okay, red light or green light. Red light meaning, okay, stop, you are abnormal, you have to die.
Okay.
And there is no cancer.
All right.
So for some reason, the red light doesn't happen, and then those abnormal cells multiply, and cause lump. Or in breast cancer case, initially it may be calcification, microcalcification, which we can find on mammogram.
Yeah.
And then at one point it starts spreading, and this is the invasive cancer. And indeed, cancer can spread to organs around or to distant organs like lungs, bones, liver, yes.
Okay, so the breast has to be cut at some point in time?
No. Screening, and today I will be talking, it's very important, it's the message to take home.
Yeah.
Screening, early detection saves lives. Early detection saves breasts.
Okay.
Up to 80% of patients in Europe have breast conservation, which means we can remove the lump, we can remove the abnormal tissue with a bit of margin.
Yeah.
We have to assess lymph nodes because cancer usually spreads to lymph nodes first, but we can keep the breast. Sometimes there are some rare cancers we need to remove breast, and it's the safest, the best way to deal with it.
Okay.
But if cancer is caught early, if cancer is caught, and we can remove the cancer tissue, keeping the breast. Sometimes, even with bigger cancers, now what we can do, we can offer neoadjuvant chemotherapy or neoadjuvant treatment to shrink the cancer and offer breast conservation. Breast conservation always means radiotherapy, because we have to reduce the risk of cancer coming back to the same breast.
Okay.
This breast needs radiotherapy,
All right.
adjuvant radiotherapy.
All right, that's amazing. And I'll be coming to you to ask on the lifelong effects of this treatment. But yes, we have, I think we can push this here. So allow me to break the rules a bit.
Yes.
So we can take a look at what is there briefly in about a minute or so. Tell us what it is that we have. Probably they're not able to see this. We have lime.
Lemon. Yes, this lemon alkalinizes your body because cancer thrives on an acidic environment.
Okay.
So when you take lemon water in hot water, as often as possible, it does that. Of course, women will take it for losing weight. So I guess if you lose weight, personally, as it helps. Yes.
Okay.
Now, of course, we know the doctor says an apple a day
Keeps
with
the
all the
doctor away.
vitamins.
You want to be kept away,
So
that's right.
yes, and of course, ginger. Even we all know about dawa. When you go, you have your flu and all those other conditions. Most of the time, you'll get ginger, and they've told us even it has helped a lot in this time of COVID. You know, ginger is very important, and turmeric, and anti-inflammatory. You know, because we have a lot of inflammation in the stomach and so forth, and it also helps to avoid blood clots and so forth.
Okay.
Because it helps to thin your blood, to a good level. Of course, everything should be taken in moderation. This is something called kombucha. You prepare. It's just a drink. I will have to share with you later on how you prepare it.
The recipe,
the recipe. But it cleanses the gut system.
Okay.
Yeah, the gut system. It's called kombucha. It's in every supermarket, major ones, Chandaria and all those.
What do you use?
Kombucha.
What
You just drink. You prepare.
He's asking the components.
What is it made of?
It's made from how do you say? It's called Scooby. It's something that has just been done through the years. So if you want to come, I'll cut for you a piece. I'll cut for you a piece. You go, you do your tea.
Scooby is in the market, ready?
Yeah, I don't know whether you get the Scooby because that's the mother. You know apple cider vinegar?
Yes.
Apple cider vinegar is made from some original source. This is the same.
Okay.
But this one is, shall I call it like an algae or something that started somewhere, God knows which country.
We need to do that.
Yes, no problem. We'll talk
Okay.
about it another time. These are guava fruit.
Yes.
And all fruits, let me say in general,
Agree.
but personally I have these guava trees. And there's another tree that they say helps to kill the cancer, the graviola fruit. It's the custard apple, but sour
Yes,
soup
sour
actually. Yeah. Now the rest of these are herbs, sage.
Okay.
We have basil. I just brought some. We have basically used all other herbs, dania and so forth when you are cooking, because I believe they just help to not only make your food nice, but maybe
bring in the nutritional aspect of it.
Of the different, like this for me, when I use sage every time I do meat or fish, I use sage because I believe it also reduces all the fat that is there. When I do my bone soup, this is honey to replace, of course, sugar, and you have to get the natural one, not the one sometimes has sukaringuru, those things. This is chia seeds. I'm sure you know chia seeds. You put a spoon, yes, of course, all of them, even calcium and so forth. This is Artemisia.
Okay.
Madagascar has been using it. Tanzania and Doctor is interested.
Artemisia.
Yes, Artemisia annua, and I have got even some seedlings coming from Germany, US. So it's a plant that grows this high, but it has got quite a number of benefits. And as I said, they've been using it to fight COVID.
Yeah.
But for me, I started using it in 2017 when I got reconstruction. We're talking about breast. And this, the first time I did lumpectomy, what he says, that when the tumor shrunk, then now you can just remove the small part with the margins. That was 2014 in Aga Khan. But 2 years later, when I went to India for a PET scan, that time Aga Khan did our PET scan, they found still another lump quite near the bone.
Okay.
And before they had removed the breast and the nodes, but still there was a lump that was found quite. So I was told, no, ma'am, we just have to remove the breast. It was stage 3B. And I hear when the cancer is cut, it spreads faster. So we were very scared of having it cut.
Okay.
Yeah. So, but now when I went there and they saw that lump which was quite near the bone, and I'm triple negative, so my cancer is not known the cause. It's not genetic and it's not hormone based. Yeah. So therefore the doctor said, no, in your case, because it's triple negative, it can be a very aggressive, and as you can see, this has happened. We don't know where else it could go. Okay. So now I had to plan and psychologically accept the breast to go. It's difficult for women, we have stigma and so forth. Yeah. But so when I did reconstruction of the breast, because I still wanted it back.
Okay.
Yeah, so anyway, and wherever they put, the Bible says, when you try to put new wine, it doesn't work. So I had 30 sessions of radiation, and of course the chemos and the surgeries before. I've had 7 surgeries. Actually, that reconstruction was 3 surgeries.
All right.
Yes.
Lots of myths that come along.
So I took the Artemisia to heal.
To heal. All right, and a lot of things that, by the time you're having this condition, anything that is brought your way, you will grab it without asking all these questions. So I know you have agreed that it's important we have it balanced, and I would want to assume that everything that we have here is balanced, apart from this one that we still do not know what exactly.
Kombucha.
I think right after this,
even right now, if you do Google immediately after this, you'll see it. Yeah.
All right.
You don't have me for me, I'll bring for you.
Okay, well, all right. So in about a minute or so, Doctor.
Yes.
Dr. Marek, in about a minute or so, what she says, one, does it spread faster when you lose the breast? And in this case, the medication, what are the long-term effects of this? Because with radio, the chemo and all that, we see almost instant effects in someone's body. Eventually, are there long-term effects as we wind up?
When we talk about breast cancer, everybody thinks that there is one type of cancer.
Yeah.
Now we know that there are at least 10 different types. Some cancers feed off estrogen, the female hormone. Some cancers don't. Some cancers are HER2 positive, some cancers aren't. And depending on we call it immunohistochemistry, all those receptors, we can offer different treatment. So sometimes some patients, some ladies say, oh, but a friend of mine had cancer and she had this and I don't. Why? Because there are different cancers. Now, surgery usually is the best way to treat any cancer. Once we remove it, we remove the cancer, it's gone. For many, many, many years, we thought that mastectomy, and more than 100 years ago, in 1860s,
In summary,
in the 1860s, one surgeon in America said that once we remove the breast, once we remove the muscle, once we remove almost a quarter of a human being, we'll cure cancer.
okay.
And for 100 years, we surgeons, we believed that this is the way to deal with it. What happened was, with time, we understood that some cancers come back.
Okay.
Why? And now we know that it's those more aggressive cancers, those triple negative, those HER2 positive cancers,
Yeah.
surgery is not enough. And that's why it's very important to have the adjuvant treatment. For breast conservation is radiotherapy. It's almost like buy one, get one free. It comes as package.
Yeah.
If we want to preserve the breast, then it's called breast conserving treatment. Radiotherapy is a part of the treatment. For estrogen positive cancers, it's the hormones, the tablets. For non-estrogen positive cancers, it's very often chemotherapy. For HER2 positive cancer, it could be Herceptin. And now, all of those medications, of course, may have some side effects. Everybody's different, so everybody will react in a different way. But fortunately, we have ways of dealing with those side effects, and this is definitely helping as well.
Good.
So that's why it's always very important.
All right, thank you so much. Is the entire month, yeah? So I want to believe that we can have another session and expound the same even more, because it's important that we get the people to learn, because we said, well, it's awareness month, so we give as much awareness as we can. Yes, we'll do that, yeah? Let's work around that. Thank you so much, Jane Francis, for the great insights, and also Dr. Marek for the great insights. I look forward to see you again some other time. Thank you.
October, we'll meet at the St. Paul's University Chapel Hall, and we'll discuss so many things, matters cancer, and hope Dr. can also come and answer their questions. They will be survivors.
Thank you.